Bismillahirrahmanirrahim. I am Dr. Hafiz Muhammad Asif, Associate Professor in Department of Eastern Medicine and Surgery, Faculty of Medicine and Allied Health Sciences, the Islamia University of Bahawalpur, Pakistan. The topic of my presentation is early detection and assessment of COVID-19. We know that SARS-CoV-2, which is the RNA virus and is responsible for COVID-19 pandemic. The background of my research work can be understood easily by this graphical figure. We know that the PCR have been reported as a confirmatory test for the confirmation of COVID-19. And it has also been reported that PCR will be positive after 1 week of exposure of virus. So we have noticed that in this week, before the positive PCR, there are some changes in the blood biomarkers, and there are some mild signs and symptoms which are going to be appear in the body. This is the method which have been adopted in this research work. This is actually a retrospective study. And importantly, the signs and symptoms were evaluated by two-tail chi-square test with Kramer's 5 strength. And the severity of disease was divided into 4 tiers. And a new chart was developed, which was named as Hashmi-Asif COVID-19 chart. In this chart, both scoring method was used for the scoring of symptom and for the scoring of blood biomarkers. It's a retrospective study, and it can be seen here that we have collected and analyzed the data of 10,172 patients, which have been cited, which have been reported by these authors in their publication. And interestingly, it can be seen that the cough was the fever was the most prominent feature which was reported in 4,466 patients, while the important change which is going to be appear in the blood biomarker was the lymphopenia, which was reported in 5,024 patients. These symptoms and these blood biomarkers changes have been recorded before positive PCR in the first week of exposure of COVID-19. This is the graphical representation, and it can be seen that among symptoms, fever was the most prominent, while among blood biomarkers, lymphopenia was the most prominent change, which is going to be appear in the body. This is another representation of the data, and it can be seen here that the PCR is going to be positive at the day 6, while at day 5, day 4, day 3, day 2, there are some symptoms which have been appeared, and there are some blood biomarker changes which have been appeared in the body before day 6. And if we evaluate these changes in the blood biomarkers and the symptoms, the COVID-19 prevalence can be halted. You can see here that at day 2, there are 4 changes have been noticed. Among them, fever, among them the fatigue, and among them lymphopenia, and the cough is important. And this is the percentage of all the symptoms and as well as the blood biomarker changes which have been noticed, which have been recorded and reported in the publications. And the frequency of all these symptoms and blood biomarker changes was calculated. After that, the Hashmi-Asif COVID-19 chart was formulated. And in this chart, we have allocated the scores to all the symptoms like in this manner. And similarly, we have allocated the scores to the blood biomarkers. And in conclusion, we can see that if the score lies between 13 to 22, the disease will be in a mild stage. And if the scores lies between 23 to 33, the disease will be in moderate phase. And if the score lies between 34 to 39, the disease will be in severity. In cumulative scoring, more than 14 to 22 out of 39, if the score lies between this range, this patient can be sent for further confirmation through PCR, and it will be isolated and it will be sent in quarantine. So this score indicate that the course of COVID-19 is progressing. And we can also calculate if the scores of the star values is more than 7 or equal to 7 out of 15. It also indicates the presence of COVID-19. The importance of this chart is that Hashmi Asif COVID-19 charts provide an early approach of sensing COVID-19 at an early stage as compared to conventional methods and PCR, etc. Early mild sign and symptom provide an early intervention opportunity as well. And the chances of missed diagnosis will be reduced, while the aggressive testing can be done as it is cost effective. As we know that the CBC and LFT are not so much costly, and if we perform these two tests, and if we found the lymphopenia, and as well as the symptoms which have been described in detail in previous slides, so we can detect on early stages. COVID-19 can be sensed at more than 30% population as compared to 8.9 sensitivity. Sensed at early stages yield 95% positivity. This data have been published in a renowned journal, Frontier in Medicine. Thank you very much.